Hello, my name is Laura Brown. I'm an occupational therapist here at University Hospital. This is Lauren Lively. She's an OT senior at GRU here doing a clinical rotation, and she's agreed to help us today with our presentation on exercises for your total joint program for your shoulder. And Lauren is going to be our patient. A few things that we want to let you know about is that we would love for you to bring with you for your procedure a shirt that is 2 sizes bigger than what you normally wear. And a button up or snap up would be preferable, because we're going to be showing you how to safely dress yourself so that you don't injure your shoulder. In addition to your button up or snap up front shirt, also bring a pair of stretchy waisted pants that are easy to pull on and a pair of slip-on shoes to wear home after your procedure. The other thing that we want to let you know about is the immobilizer that you'll be wearing. When we come to see you after your surgery, we will be teaching you how to get in and out of your immobilizer properly. The immobilizer is designed to protect your arm while it's healing. We don't want you actively lifting that operated arm because the muscles and the tendons have to heal properly. So this morning what we're going to do is kind of go through the exercises that we would show you when we come to your room that first morning. We want to make sure that your pain level is in a good place when we come to see you, so we'll ask you, Miss Lively, how is your pain this morning?
5.
Good. Middle of the road? Okay, have you had any pain meds?
Yes.
Good. Alright, those should kick in quickly, and you just let me know if any of these exercises cause you any increased pain.
Okay.
Our first exercises that we're going to teach you this morning are going to be the ones that you do in your immobilizer. So we're going to look at the hand, the wrist, the forearm, and the elbow.
Okay.
The first one we're going to do is for your hand, and this is because a lot of times when you're wearing a sling, your fingers may get a little bit puffy, and it's just from being in that dependent position and not moving as much, and your muscles aren't moving as much. So we're going to use a stress ball that you'll get with your immobilizer, and I'll have you hold that stress ball and just give me a good squeeze, and we're going to do 10 repetitions. For your exercises, you're going to be doing these 3 times a day, and we recommend that you space it out. Do a morning session, maybe another session after lunch, and then a session after dinner. So with all of these, you're going to be doing 10 repetitions and 3 times a day for all your exercises. So the hand one's easy, you're squeezing the ball. The next one's going to be for wrist. So Lauren's going to move her wrist up and down or side to side, but she's going to be moving through full range within a pain-free level. If you have a pre-existing problem with your wrist or your hand due to arthritis or any other pre-existing conditions, let us know. We want you to be moving in a nice pain-free range without any pain extra on top of what you're already dealing with. Now the next one will be, and I'm going to undo the front of the immobilizer, which we will be showing you how to do all this. The next exercise that Lauren's going to do is for the forearm. She's going to rotate her palm upward, which is supination, and she's going to rotate down, palm down, and that's pronation. And then she'll repeat. Any pain with that one, Lauren?
Mm-mm.
Okay, good. Alright, and the next exercise is for your elbow. So for elbow flexion and extension, you'll have pillows hopefully propped under you to help support your arm. While you're recuperating at home, the best idea is if you have a recliner, that's a good spot to recuperate. You know, surround yourself with pillows, sit in a recliner, and you should be good and comfortable to do your exercises. So for this one, Lauren's going to bring her hand up toward her shoulder, and then she'll bring it back down, and she's supported by the pillow. This one you may feel a little twinge up in the shoulder area because of the movement. Does that one feel okay?
Mm-hmm.
Good. Alright, next we're going to look at shoulder flexion And this will be a passive movement. We do not want you activating your shoulder muscles on that operated side. So for this one, Lauren's going to take her other arm, she's going to reach and grab her wrist, and she's going to try to move her arm upward, and I'm going to be here to help. We'll do this together the first morning after surgery, and then come back down. You may not be able to go as high as Lauren's going, but we'll get you moving. And again, it's a passive movement. This arm's just going for a ride. And we would try to do 10 repetitions on this as well. Okay, I'm going to let you rest it there. Throughout the process, we'll be cueing you to make sure that you're not activating your muscles in the shoulder. And then we'll also be cueing you to protect your arm. There's another exercise that we like to do for internal and external rotation. And we use a dowel for this. So Lauren's going to actually hold the dowel. Again, she's not using the muscles on that right arm in the shoulder area. She's just holding on to grip the dowel. But her left arm does all the work. So that's the key here, is that you're doing passive movement. She's going to do a side-to-side movement out just a little bit, about 30 degrees. And it shows you in your packet a picture of someone holding a dowel and moving side to side. So we'll mark it on there and remind you that you don't want to go past 30 degrees. So neutral would be straight in front, 30 degrees would be out just a very slight bit from the side of your body, and then back across. So it's a very tiny movement, and we would do 10 repetitions there. Good. Thanks, Lauren. Okay, take care of that hand now, don't let it drop. For this next segment of exercises, you will actually be seated on the side of the bed. So we'll ask you to sit up on the edge of the bed. I'll be asking you, how are you feeling? Is your head feeling okay? Any dizziness? If you're dizzy, we'll sit there for a few minutes and kind of let you get to feeling right. Sometimes with the pain medications, you may feel a little woozy when you first sit up. Also, I'll be checking again on your pain level. How's your pain level? Are we okay? Do I need to get the nurse for getting more meds? Okay. So next we'll have Lauren stand up, and we're going to be teaching her how to take off her immobilizer. And this can sometimes be a little scary just because of all the hooks and straps. But the easiest way to do it is to first undo the neck strap, and what you're going to do is just loosen it very loosely. You're not going to take it all the way off, and that way she can bring it over her head like that. The next step would be, and she's going to be holding her hand right here, so we don't want it to drop, so just hang on to your fingers right there. We're going to undo the front of the trough. This is your little trough strap, so that she can actually get her arm out of the trough itself. And then there's a waist strap. So for the waist strap, we're going to undo that, and I'm going to ask her to hold on to that arm, because I'm going to bring this pillow out from under the arm. So now she's out, except for this part. I'll hold. There you go. She's totally free of her immobilizer, but she's holding on to this operated arm. And I'm going to ask Lauren to bend forward with her arm and gently lower it. So try to lower that arm, and I'll be right here. A lot of times, because of how small the hospital rooms are, we'll be right next to a sink. So if you start feeling wobbly or anything, you can take your non-operated arm and hold on to the sink area or to the bed. So you'll be leaning down and just letting it hang, and we'll be cueing you to totally relax these muscles. Your instinct is going to be to tighten up and protect that arm, but we want you to actually let it hang. That may feel a little odd, but you'll get used to it. And then I'm going to ask Lauren to take her feet and do a wide stance for me. Okay? And Lauren, you're going to sway back and forth, side to side. And just let that arm hang like a rag doll. Good. And she'll do 10 of these. Good. The next one, Lauren's going to put one foot in front of the other, wide stance, And she's going to go forward and back. And same thing, she's just kind of letting that arm go for the ride with her body. The motion is all from your body moving with you shifting your weight from leg to leg. Your arm muscles are not working. Good, Lauren. Okay, and we're going to go back to our wide stance. The next one's a circular motion. So she's going to have her knees going in a circle. This is the hardest one for people to get. Some people have more. Depending on how good your knees are, if you have knee issues, this one's a little tough. Good, Lauren. You got some good knee work there. All right, and then I'll say, all right, let's stop for a minute. Let it relax. I want you to take your other hand and hold this arm and gently stand back up. So stand up all the way. Very good. How was that?
It's okay.
Okay, good deal. So at this point, what we're going to do is teach you, while you're out of the immobilizer, we're going to go ahead and dress you, teach you how to put on your shirt, because you want to make sure you dress that arm first. So let me grab the shirt here. You want to bring a big shirt that buttons up or snaps. And to actually dress yourself, at this point, hopefully the nurse would have disconnected your IV to make it much easier. If not, we'll have her come in and do that. And I'm going to ask Lauren to lean forward again, just like we did for the pendulum exercises. So lean down, Lauren, and you're going to put your arm in the sleeve. And then you're going to put your other arm in. So you'll have a family member helping you with this, hopefully. And then you'll grab that arm and you'll gently bring it back up. So for anything, whether you're dressing yourself, let's say you're washing under there when you're taking a shower, you're going to lean down to get to that armpit area, because we don't want you to lift. No lifting of the arm. So this is how you dress yourself. Now once she's dressed here, we're going to go ahead and teach Lauren how to get back in the immobilizer. The easiest way for you to do that is to remember that you've got that shoulder strap already cinched. So we're just going to put that over Lauren's head, and we're going to gently let her ease that elbow in the trough. There you go. You in there? Mm-hmm. Now this pillow is called the abduction pillow. It kind of keeps your arm out from your body just a little bit. And it's curved to go around the side of your trunk. So just make sure that it's fitting comfortably. And then you're going to go ahead and make sure that you tighten this one. And bring the waist strap around. And the waist strap secures right here on the back of the pillow. So I'm going to let you turn just a little bit so they can see. See, it has a little hook right there. And we're just going to tighten it up. And you want it good and snug so that it feels secure to you. And then we're going to have her turn back. And now we're going to do the arm trough. We want to make sure your elbow's back in there really well. And this front loop is for the arm trough. And you cinch that. Now, you'll notice that her arm is straight across. It's not hanging down. It's not ganked up on her chest. It's straight across. And we'll ask you, is it comfortable? Mm-hmm. Do we need to tighten it anywhere? You might want this one a little tighter. All right, is that good?
That's good.
Okay. So now we've donned your immobilizer. You're in your best buddy right now because this is going to protect your arm. It's just to remind you not to actively lift. Now that we've taught Lauren, our patient, all of her exercises, we've also taught her how to put on a shirt, keeping her arm protected. We've taught her how to take off her immobilizer and put it back on to protect her arm as well. So at this point, we'll just kind of go over with you that you do have a little diagram or instruction sheet on other exercises that you will be doing later on as you heal and as you rehab. You'll already probably have an appointment set up to go for your first outpatient visit within 4 to 5 days after your surgery. Okay. So in the meantime, while you're home, do the exercises that we've shown you this morning.
3 times a day?
Yes, 3 times a day, 10 repetitions for each exercise. If you have any questions, you call us, and we'll be glad to talk with you, talk you through it. And just remember to respect your body and listen to any pain that you have. But then once you go to your outpatient therapist, they'll be guiding you through the next steps to make sure that your shoulder gets back strong and healthy and no pain.
Okay.
And we appreciate your choosing University Hospital. We hope that you'll have a good experience with your total shoulder surgery, and we look forward to seeing you. Thanks.